Welcome back, everybody.
For those of you who missed it this morning, details about the event package can be downloaded via a QR code on the pamphlet at the center of your tables. And if you're joining us virtually, you received it in an email, the QR code.
If you're wondering what's sitting at your table, yes, that's right. It is olive oil. We're doing shots of olive oil.
It's a very Mediterranean moment.
Only at the Brain Health Summit.
There are crackers to enjoy as well. Our next speaker is diving into nutrition. Dr. Mary Sco is an MD, PhD, physician, and nutrition expert who translate nutrition science into practical, evidence-informed guidance.
She'll be exploring the brain health benefits of olive oil, so yes, the olive oil shots were intentional.
Not just Matt's idea of a party. Please welcome Dr. Mary Sco.
All right, good morning, everyone. It is always such a pleasure and such an honor to be here at the Brain Summit. Let's get started. In October 2025, Health Canada approved the first ever drug to prevent the progression of Alzheimer's disease. It's called lecanemab. It costs $32,000 per year. It requires an infusion every other week, and it requires frequent MRIs to monitor for the most common side effect, which is brain bleeds. But lecanemab has been criticized because of its minimal clinical effect. The studies show that if you take lecanemab for 18 months, it will slow cognitive aging by about 5 months. Interestingly, if we compare this to research that's been done on the Mediterranean diet, studies have shown that strict adherence to the Mediterranean diet can slow cognitive aging by about 12 months over 24 months. So what's interesting is if you make this comparison, it looks like what you eat may be even more effective than this medication. I love making these diet versus drug comparisons because so often that is what you see. The food you eat can be more effective than the medications that I went to school for a very long time to be able to prescribe. But let's back up a second and talk about where cognitive decline and where things like Alzheimer's actually come from. Now, this is overly simplistic. You know that part of what's happening is there's this buildup of protein plaques and tau tangles that ultimately accumulate in the brain and destroy brain cells. You're probably thinking, how do these proteins end up there in the first place? Well, proteins are not in themselves bad. There are all kinds of proteins floating around in our bloodstream every day. There's one in particular called tau. Now, tau is a good thing. Tau stabilizes the cells in our body, and we all have tau floating around inside of us right now. But what can happen is tau can become chemically altered. And when tau becomes chemically altered, now it's potentially harmful because this chemically altered form of tau can accumulate, clump together, form these tangles, and ultimately take up residence in our brain and destroy our brain cells. And this is part of what can lead to cognitive decline in things like Alzheimer's disease. Interestingly, just last year, the FDA approved a new blood test where you can actually measure the amount of p-tau that's in your blood. And the idea is that that blood level of p-tau actually correlates with the amount that's accumulating in your brain. So it's meant to be this like risk factor that you can measure from a blood test to understand if you're at risk for dementia or Alzheimer's disease. One of the ways that this new drug, lecanemab, works is it actually lowers the level of p-tau in your blood. Interestingly, there's also research that shows that 3.3 tablespoons of extra virgin olive oil consumed daily can also lower your levels of p-tau by about the same amount in just slightly about roughly the same amount of time, which is quite interesting. And if you do a cost comparison, lecanemab, as I mentioned before, costs $32,000 per year. How much does the olive oil cost? Well, this is going to depend, right? Because it's going to depend on what kind of olive oil you buy and which one you choose and all these different things. So let's imagine that you go to Eataly in Yorkville and you decide that you're going to buy the most expensive olive oil that they have. And it's this one. It retails at $59.99 per liter. And this one is advertised as being like a monocultivar. It's from this one particular grove. The olives are hand-picked and they're pressed within hours. This is like the highest quality stuff that you can get from this kind of a store. So let's say you go to Eataly and you buy this olive oil. And you consume 3.3 tablespoons per day. How much is it going to cost you? Well, at the end of a year, it's going to cost about $1,075, which sounds like a lot of money to spend on olive oil, but if you compare it to the alternative, it's pretty cheap and it has a pretty good effect. And of course, lecanemab is not covered by OHIP. So all of this is to say that when it comes to promoting and protecting brain health, the solution doesn't come from here. It comes from here. This is a really interesting study published in 2024, 92,000 adults followed over 30 years, published in JAMA, and they found that as little as 1/2 tablespoon of olive oil per day can actually lower risk for dementia-related death. And what's so interesting about this finding is that this 1/2 tablespoon of olive oil has this effect irrespective of the background diet. So it doesn't matter what else you're eating. Just by having this 1/2 tablespoon of olive oil, you're going to have a meaningful benefit. But this is not news. We have known for thousands of years that olive oil is medicine. In 500 BC, Hippocrates identified 60 different medicinal uses for olive oil. The ancient Greek athletes used to rub olive oil all over their body because they felt that it actually enhanced their strength. Today, we know that there's actually evidence that if you rub olive oil on your body, particularly on your knees if you have osteoarthritic knees, the anti-inflammatory effects of that olive oil can actually decrease osteoarthritic knee pain. Impressively, even more so than the topical medications, again, that I prescribe every day. So olive oil is pretty impressive. Cyrannus of Ephesus, who was the founder of obstetrics, he was a famous ancient Greek physician, interestingly said that every newborn baby should be anointed with olive oil when they're born. I thought this was kind of interesting because when I was a medical student, doing my first obstetrics rotation at St. Michael's Hospital in downtown Toronto, I remember that they had this interesting practice there where just as the baby was about to be born, they would splash olive oil on the baby's head, and it was intended to provide lubrication. That never really made sense to me because I was like, well, the baby's already kind of out, what are we lubricating? But when you're a medical student, you don't ask those kinds of questions. You just do as you're told. But anyways, I just remember being there, being very nervous, and suddenly you're wearing these gloves, your gloves are covered in olive oil, the baby's covered in olive oil. It makes a slippery situation that much more slippery. And I remember being very stressed out by this olive oil thing that they did at St. Michael's Hospital. But now when I think about it, I'm like, that's actually kind of interesting because even all these years later, these babies are still kind of getting anointed with olive oil when they're born. In Homer's Odyssey, which is, of course, one of the oldest surviving works of Western literature, and it's the tale of a hero's journey home after the 10 years long Trojan War. He talks about when he gets home, there's all these treasures waiting for him, right? There is gold, there's bronze, and of course, there is a large store of olive oil. When I think about a large store of olive oil, it kind of reminds me of every Southern European family's basement, where you're going to find a large store of olive oil. There is this really interesting study where they wanted to quantify how much olive oil did they eat in ancient Rome. And they were able to do this by digging up the bones of people who perished when Mount Vesuvius erupted in I think it was the 1st century. And there's a lot of science here that I don't understand, but somehow they do this isotope analysis, they analyze the bones, and they're able to make these conclusions about what people were eating in the ancient world. And based on this research, these scientists concluded that the ancient Romans ate about 20 liters of olive oil per person per year. So to illustrate that for you, one of these tins is 17 liters. So that's a little more than one of these tins per person per year. It works out to being about 4 tablespoons per day. What's really interesting is that these 4 tablespoons, which we now know was roughly the amount that people were eating in ancient Rome, is actually equivalent to what's recommended in the modern Mediterranean diet. And if you remember from a moment ago, it's also consistent with the amount that we know can lower those levels of that protein in our blood and have that benefit. So if I had to come up with a recommendation of how much olive oil you could aim to eat in a day to get maximal benefit, it would probably be about 4 tablespoons. So I come from a family that takes olive oil very seriously. I always joke that when I moved away from home for the first time, my father's biggest concern was where I was going to get my olive oil from. Now, more recently, I moved away from Toronto, and when I was settling into my new place, I just went to a normal grocery store and bought a normal person's amount of olive oil, which is about a half liter. But the problem was, 2 weeks later, it was all gone. Thank goodness, I lived right next door to a wholesale food depot for restaurant owners, where you could get very large quantities of very high quality products from all over the world. And there I was able to buy very high quality olive oil in large quantities that met my needs. This also meant that over the last few months, I was able to quantify my own olive oil intake. So what I calculated was that over the last 9 months, I consumed these 3 tins, just by myself, which is about 9 liters of olive oil, which means I'm consuming about 1 liter per month, which means my intake is about 12 liters per year. So actually, that's not so good because I'm like way behind what the ancient Romans were doing, and my daily intake is only 2.2 tablespoons per day, even though, again, like I take this very seriously, and I thought I would have done better. So I'm not quite at those 4 tablespoons, but the point is, as I showed you before, even 1/2 tablespoon makes a difference. So every little bit counts, and if you can make it to the 4, that's great, but even I'm not there quite yet. It's also really important to realize that not all olive oil is created equal. One day when I was at the Food Fest Depot, I noticed that they were promoting this brand of olive oil, which of course has a lovely picture of an olive. It's got that green color. But when I looked at the side of the tin, it's actually 90% refined soybean oil. So this is one example of one of the common pitfalls that you can become victim of, is you have to look at what you're actually buying, because it might look like olive oil, it might be like placed with the other olive oils, but it might not be olive oil at all. So you have to watch out for this. But there are also olive oils that you'll find on store shelves that are actually olive oil. This one says 100% pure olive oil. So what's the difference between this kind of like low quality olive oil you might buy and the high quality olive oil that you would find at my parents' house? Interestingly, the type of fat is the same. Whether you're having low quality olive oil or high quality olive oil, it's still monounsaturated or MUFA fats. What does that mean? So all olive oil is this particular type of fat, MUFA fats. And in order to understand what this type of fat is, I need to introduce you to this thing that I like to call the dietary fat family tree. So the dietary fat family tree is my framework for illustrating all of the different types of dietary fat and how they're related to one another. So the first branch point in the dietary fat family tree is your saturated fats versus your unsaturated fats. So saturated fats are the kind of fat that you're going to find predominantly in animal products, things like butter, meat, dairy products, and also coconut oil. And on the flip side, within the group of unsaturated fats, we have a few different types. One type of unsaturated fat is these monounsaturated fatty acids. Sources of monounsaturated fatty acids. You can get it from olive oil, you can get it from avocado, from a few sources of nuts, but that's pretty much it. On the flip side, you also have these what are called polyunsaturated fatty acids. And polyunsaturated fatty acids also have a whole bunch of different types. You have your omega-6 fatty acids, which is what you're going to get when you're eating vegetable oils or when you're eating seed oils. And then you have your omega-3 fatty acids. And within the group of omega-3 fatty acids, you have all of these different types that can be somewhat converted from one type to another. But all of this is to say is that part of what makes olive oil so unique is it's this one particular type of fat that you're not really getting from anywhere else. And that is particularly helpful. So even though all real olive oil is composed of these monounsaturated MUFA fats, these two types of olive oil are still not equivalent. So what's the difference? When you're getting the highest quality olive oil, you're not just eating a healthy type of fat, but you're eating that healthy fat infused with countless plant nutrients. Keep in mind, olives are fruits. So when you press an olive and obtain its oil, you're not just getting oil, you're also getting all of those nutrients that are inside that fruit. So you're getting this oil infused with all these nutrients. And when you get the first, you're going to get lots of those nutrients. When you're getting the 10th press, you're going to be getting whatever's left over. One example of a nutrient that you find in olive oil is this compound called oleocanthal. Oleocanthal is basically nature's Advil. It's very anti-inflammatory. For the doctors and scientists in the room, it's basically a COX inhibitor. It's like taking a low-dose NSAID. It's almost like a baby aspirin every day. And we also know that one of the things that oleocanthal does is it actually attaches itself to those tau proteins. And in doing so, it prevents those tau proteins from getting chemically altered, which ultimately prevents them from being able to accumulate in the brain and destroy brain cells. So all of this is to say that a large reason why the olive oil has these large health effects is because of these plant nutrients that you find inside of it, like oleocanthal. And that's just one example. There is active research being done, and we don't even understand what's in the olive oil. There's more than 600 different chemical compounds in olive oil. And they're doing all kinds of different things, and it's an active area of research. So, as I've illustrated for you, this is why not all olive oil is created equal. So with that in mind, how do you make sure that what you're getting or what you're buying is going to give you all those healthy nutrients? Well, there's a few things that you can look for on the package or the container. So first, you want it to be from a single country of origin, because then you kind of know that you kind of have a better sense of what's going on. When it's a mix of like 5 countries, like who knows what's really going in there or what's really going on. You also want to make sure that it says extra virgin and first cold pressed, because that's how you know that you're getting that first press where all those nutrients are going to be extracted and you're going to get the maximum nutritional value in that olive oil. Let's back up again and talk even more deeply about where cognitive decline comes from, because it's very complicated. It's ultimately a product of many, many factors. I find that we often overly focus on the genetic factors, and genetic factors are part of it. But interestingly, one of the messages that I want to give you today, and this relates to the brain, but it also relates to other areas of health as well. Your genes are not your destiny, at least typically. This study of 200,000 people over 8 years, published in JAMA, showed that adherence to a healthy diet can offset genetic risk for dementia, even among patients with the highest genetic risk. This is impressive because often people have a family history of something and they feel like there's nothing they can do. The research actually suggests otherwise. And when we go back to this slide that I showed you at the beginning, the notion that what we eat could be more effective than this new medication coming down the pipeline, the question is why? Like, why would nutrition be more effective than this medication? Well, part of the reason is because this medication is primarily only influencing one aspect of the etiology of cognitive decline, which is the buildup of these proteins. Meanwhile, when you eat a healthy diet, it's not just lowering the amount of these proteins, it's also improving the health of your blood-brain barrier. It's also decreasing oxidative stress. It's also decreasing mitochondrial dysfunction. It's also influencing your immune system, lowering inflammation. All of these factors are what lead to the outcome, and diet is able to target every one of these factors, even genetics. This is a really interesting study where they did autopsies on people's brains after they had died, and they measured the amount of plaque in the brain, and they correlated that with what they were eating. And what they showed was that consuming the Mediterranean diet actually resulted in less plaque in the brain when they did those autopsies after people had died. So at this point, you're probably thinking that the entire point of my presentation is to tell you to eat the Mediterranean diet. Now, if you want to eat the Mediterranean diet, that's great. I'm not going to suggest against it. But I have a very controversial opinion. And my controversial opinion is that I actually never recommend the Mediterranean diet. But the truth is, I never recommend any diet. I'm a huge Richard Simmons fan, and I have this book of his called Never Say Diet, and I agree with this principle. It's not about one diet and one solution and a one-size-fits-all. I really believe that everyone's ideal diet is different, and it's about finding the pattern that works for you, that has the foods that you enjoy, that fits with your cultural preferences. So I'm not necessarily saying that you have to adopt the Mediterranean diet. And instead, what I like to do is I like to deconstruct the Mediterranean diet. And there's this really nice study where they asked the question, what are the most important components of the Mediterranean diet that are responsible for its benefits? And this was a meta-analysis of 11 randomized controlled trials and prospective studies. And here's what they found. It really comes down to 3 things. First, it's the olive oil, of course, right? Like, that's why we're talking about olive oil. So the olive oil is a huge reason why the Mediterranean diet has the benefits that it has. The second component is vegetables, particularly dark green leafy vegetables. I could give you a whole presentation just on dark green leafy vegetables. That was my talk at the first Brain Summit 2 years ago. I cannot say enough good things about dark green leafy vegetables. I really enjoyed the ones that we had at dinner last night. And what I'll show you to illustrate how powerful they are is back to that study where they did the autopsies on people's brains and measured the amount of plaque after they had died. The only food that was correlated with the amount of plaque in the brain was dark green leafy vegetables. They showed in this study that the more dark green leafy vegetables you ate, the lower amount of plaque you had in your brain when you passed away. And the third component is beans. To keep it really short, basically beans, or more specifically the fiber that the beans contain, feed our gut microbiome, which is the trillions of cells that live inside our intestines. And then those bacterial cells talk to our immune cells that live right next door. And then those immune cells amplify those signals in the form of anti-inflammatory messengers that ultimately float around through our bloodstream throughout our body and can influence our brain health. So that's it. It really comes down to these 3 foods and eating them every single day. So every year at the summit, I give out a nutrition prescription for brain health. So this is this year's nutrition prescription for brain health. First, you want to aim to eat 4 tablespoons of extra virgin olive oil every day. You want to aim to eat dark green leafy vegetables every day, ideally with the olive oil so that you can maximally absorb the nutrients. And ideally, you want to try to eat beans every day. And those 3 things we know can make a big difference and can be adapted to whatever your preferred dietary pattern is. I also want to emphasize that nutrition is only one piece of the puzzle, right? There are all of these different factors, and you have to do all of them to have the best possible outcome. So people always ask me, what's the secret to healthy eating? And the truth is, there is no secret. In 325 BC, Plato spoke about nutrition, and he said that a healthy diet consists of beans, olive oil, fruit, fish, wheat, and barley, and treats to be consumed in moderation are meat, confectionaries, and wine. 2,000 years later, nothing's really changed, right? It really is this simple. It comes down to eating these kinds of foods every day. And that's the reason why research shows that what you eat can be as effective, if not more effective, than the latest and greatest medications that are coming down the pipeline. I love making these comparisons, and it doesn't just apply to the brain. It really applies to all kinds of different conditions. So for example, we know with respect to blood pressure, 4 tablespoons of ground flaxseed per day can lower blood pressure as much as a single first-line blood pressure medication. When it comes to cholesterol, a cup of almonds per day. It's a lot of almonds. I'm not necessarily saying you should eat a whole cup of almonds every day, but for the sake of the scientific comparison, a cup of almonds per day can lower cholesterol as much as a low-dose statin medication. When it comes to depression, research shows that adopting the Mediterranean diet can enable the remission of depression at rates that are equivalent to antidepressant medications. When it comes to migraines, research shows that a diet high in omega-3 fatty acids and low in omega-6 fatty acids can result in a lower frequency of migraines compared to the latest biologic medications. When it comes to diabetes, time-restricted eating protocols, where people eat all of their food between 8 a.m. and 6 p.m. and fast for 14 hours overnight, can lower their blood sugar more than metformin, our first-line medication that we give all diabetics. Even more impressively, a low-carb Mediterranean diet can decrease your blood sugar more than everyone's favorite drug, Ozempic. The Mediterranean diet also decreases the risk for things like heart attacks, even more so than medications like Ozempic. So Sir William Osler is the founder of modern medicine, and he's famous for saying that one of the first duties of the physician is to educate the masses not to take medicine. Now, I'm not saying that you should go home and not take your medications, but it's to remind us that medication is just one thing that we can do for our health. There are all of these other things that are potentially even more important, because ultimately, food is medicine. So, we went through a lot of ideas and topics, and I want to quickly recap what we covered. So we started off by discussing that research shows the Mediterranean diet can be more effective than the new medications that have just been approved in the past year to lower or decrease the progression of Alzheimer's disease. And we talked about the fact that what's happening is these proteins are getting chemically altered, accumulating in our brains, and then basically destroying our brain cells. But there are things we can do. Things like olive oil can lower the levels of these chemically altered proteins. And a rate of about 4 tablespoons per day is the amount that people have been eating since ancient Rome that's recommended in the modern Mediterranean diet, and that can lower the levels of these proteins. But if you can't have 4 tablespoons, that's okay. As little as 1/2 tablespoon per day can make a difference. But you got to make sure that it's the good quality, high quality olive oil that's not just that MUFA healthy fat, but also has all those plant nutrients as well. And in order to get that kind of olive oil, you want to make sure that it's extra virgin, you want to make sure that it's first cold pressed, and that it's ideally single country of origin. We talked about the idea that ultimately cognitive decline is a product of many factors, and diet can impact all of those factors, including our genetic risk factors. I'm not necessarily recommending the Mediterranean diet, but that's the diet that has the best evidence. And if you reduce it to its parts, research shows that it's the olive oil, it's the vegetables, particularly the dark green leafy vegetables, and the beans that are primarily responsible for its effects. And just never forget that food is medicine. All right, so this is where you can find more of my nutrition prescriptions and other lectures and things that I've done. But olive oil shots have been this like internet craze phenomenon over the last few months. Interestingly, people are very divided. A lot of people think they're the latest and greatest thing. Other people are saying there's no benefit. Clearly, I am in favor. So with that in mind, today we have for you olive oil shots that have been distributed on the tables. So everybody can reach out and grab their olive oil shot. And so I guess we'll say, you know, everyone can take their shot. Cheers to good health.
Mary, where's Mary? Did you consult my nonna when you made this presentation?
A lot of Greek olive oil up there, Mary.
I feel like I've heard this.
We've got some
same
Italians in the room.
presentation, less scientific terms, multiple times.